This video is for basic facial, and it starts as if we have just arrived to work. So the first thing that we do when we get to work is we always wash our hands. So we're going to go to the sink, we're going to wet our hands, we're going to find a coin-sized amount of liquid hand soap, we're going to wash our hands together. We're going to wash our hands down to our wrists, we're going to wash the back of our hands down to our wrists, we're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and our nails, we're going to wash between our fingers and our thumbs. We're going to wash our thumbs, we're going to wash our wrist, and we're going to do all of this interlocking washing for a minimum of 20 to 30 seconds. Then we're going to give everything a thorough rinse under the sink. When we've rinsed everything properly, we will grab some disposable paper towels and turn the faucet off, or a clean towel. Dry our hands completely with the paper towels, throw the paper towels in the trash. If we used a clean towel, we would then put that in a closed container until time to do the laundry, and then to finish the hand wash, we would grab our hand sanitizer, 70% ethyl alcohol, and we would sanitize our hands, doing that same kind of interlocking motion. And what we would do then is, because our client is coming in for a basic facial, we would need to prepare our space for that service. So we're going to do anything we possibly can ahead of time in order to be punctual with our schedule, their schedule, and also, of course, giving them that full amount of appointment time for service. As much as we could possibly do, we're going to do that. So we want to be punctual, and we want to prep up and set up that room before they come in. So we're going to disinfect our workstation, bed, and equipment by using a disinfectant wipe and following manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean, closed container. We're going to turn on the hot cabbie and stock it with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. We're going to fill a clean steamer glass with distilled water. We will preheat our steamer. We'll dispense products needed for the service according to skin type and client's needs as follows. We will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. We'll close the lid to the product and set the portion cup tray on the tray. We will drape a facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean, laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the 3rd towel to lay across the client's décolleté. And we're just going to review what we've done here for that. So we've got our facial bed ready to go. We've got our tray ready to go, and on our tray we have water, we have astringent, we have toner. Our toner is actually a spray. We have cleanser, we have exfoliant, we have a mask, we have a massage product. We have disposable gloves, of course, because if we do need to perform extractions, we'll be using those. We have cotton rounds, 4x4s, 2 squares. We have wooden sticked Q-tips for extractions if need to be. We've got a brush for the mask. We have eye cream, moisturizer, we have a mirror, we have all the things that we would need on our tray pre-set up for our client. And then if we don't know the client, if we've never met them and they're a first-time client, we don't know their skin type, we can certainly have everything close to be able to then dispense what we need once we do that client consultation. So all of that's ready to go, and we are now able to wait for our client, and then when our client arrives, we'll be able to do that client consultation, which is what we're going to move into. So one special note there, with your client consultation, you're always going to approach and meet your client with clean hands. So my hands are clean, and then I'm also going to wash them again before I perform any service. So just so you know, as I walk to meet my client, the hands are clean. So I'm going to greet my client and escort him or her to the work area, determining the client's preferences. We're going to assess the client's needs. So they will fill out a client consultation form, and then we can discuss in further detail. We're going to assess the client's skin while we're talking, performing a skin analysis to ensure that there is no inflamed, infected, broken, raised or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours. Reason for that being, as medications certainly can affect skin sensitivity levels. Lots of different things can happen. For example, if they have allergies, so let's say they're taking an antihistamine or an allergy medication, can completely dehydrate the skin. So many things that can go into that. So we just need to know, people are taking so much medication in this day and age, what they are currently taking, if anything, and then if we don't know it, we'll certainly look it up to also find out what the side effects are from that medication or what things can happen with the skin. We're going to consult on any known allergies. Of course, they would write that down. That way we know for sure we're not using a product that might have an ingredient in it that they're allergic to. That's really important. We'll consult with the client on any facial surgeries within the last 3 months, and if the client's under a physician's care. That way we know if there's something that we need to work around or we need to be very careful with, or something that's healing. All of that could go into whether or not we could or could not do the facial. We'll assess if the client is prone to cold sores or fever blisters. So if they're prone to them, we can be very mindful on that. If they have any at all or any healing at all, we cannot perform any service at all. So that's non-negotiable, and it's super highly contagious, so we won't be doing that, and they'll know and understand that. Assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. All of those things are powerful exfoliants, as well as hydroquinone, which is like a bleach or lightener. They affect the skin in a very, very powerful way. They'll make it extremely sensitive, so we can't do anything with the basic facial. You don't want to do that. You've got to get past that 72-hour window. And then we're going to assess if they have had any facial injections within the last 3 weeks, like Botox or hyaluronic fillers. You would not want to perform that basic facial if they have, because you could move something around that's not supposed to be moved around. You've got to get past that 3-week window. All of those things need to be discussed, and there are many more things that could be contraindications, and you just have to discuss that with your client before you get started. Obviously, you're having this conversation in a more private area, and so that you can ask those questions that really matter, and if there's something that you don't understand, you can review that with your client, and if there's something you don't know, you can take the time to look it up. So fortunately, our client doesn't have any of the above contraindications. So we are allowed to proceed with the basic facial. And what we would do now is escort the client into the facial room and allow them some private time to get comfortable, change, and get into the facial bed. So you would have the drape laid out. They're going to change into that, get under the covers. So you leave for that private time, and then when you think you've given them enough time, you can come back and knock on the door. When they give you permission to enter, you can come, and then we're going to take a minute here to get them even more comfortable. So we've got a towel here that we're going to put over the décolleté, covering up a little bit more. We've got that horizontal towel, obviously, on the facial bed, but we've also got a rolled towel here that we're going to use to support under the neck a little bit more. We've got a headband. You can use a headband or a hairnet, and we're going to put that around the head of the client. And that will keep the hair away from the face while you perform that facial. And while they're getting comfortable, it is time for you to wash your hands before you perform the service. So we go back to the sink, we wet our hands, we get a coin-sized amount of liquid hand soap, and we wash our hands together down to the wrists. We wash the back of the hands down to the wrist. We wash our fingers, and we wash the back of our fingers. We wash our fingertips and nails. We're gonna wash between our fingers. We're gonna wash between our fingers and our thumbs. We're going to wash our thumbs, and we're going to wash our wrists. And we do all of that interlocking wash for a minimum of 20 to 30 seconds. And when we feel like we've gotten everything clean, we're going to rinse thoroughly under the running water. When you feel like you've gotten that thoroughly rinsed, you can grab some disposable paper towels or a clean towel to turn the faucet off with. Dry your hands completely. Toss the paper towels in the trash. Towel, if you use that, dry those hands off, and you can go ahead and put that towel, which is now dirty, in a closed container until it's time to do the laundry, and then you're going to grab your hand sanitizer. That is 70% ethyl alcohol to do all of those same motions with the sanitizer. And once you do all that, you're ready to start the service of the basic facial. So the first thing that we're going to do for our client is remove makeup. And some clients will use more makeup, some clients will use less. So you just want to make sure you take the time to get it nice and clean. And once you remove makeup, we're going to do that first initial cleanse for the client. And then you can go ahead and remove that initial cleanse. And then after you've done that first cleanse, what you want to explain to your client is that you are going to cover their eyes because a bright light is coming in. And you're going to be either bringing in a magnifying lamp or a Woods lamp so that you can do a really good, proper, professional skin analysis. So what we're going to do right now is we are going to cover up our client's eyes. And we would bring that light over and turn it on. And so I'm going to pretend as if I have a magnifying lamp. I don't have either. So what I'm going to come in here is looking through that magnifying lamp to really view the client's skin. And I'm probably going to be looking at different areas of the face, looking for different things. This client is an existing client, so we are working on certain challenges with her skin. So you're always going to have those discussions, even if it's a brand new client. If they've booked the service, there's a reason, and you want to get to the heart of that reason when you do the client consultation. This particular client feels like she's starting to see some signs of aging. She's feeling very dry and dehydrated. She feels like she has lost her glow. Pardon me. That she looks all the time. She can start to see the wrinkles. She looks like her under eyes. She feels like her under eyes are puffy. All of these things are just concerning her. So what we're doing is we're working through a series of appointments, really trying to bring that glow back, hydration back, and really work on some of those anti-aging pushes that we know we can do for our clients. But what we're going to do with this analysis is we're going to see where we are at every appointment. We're going to not only see her particular goals that she's going for, and we're going to update her on those, the things that we're working together on. But we're also learning our client's skin, and we're going to either be recording it in a software system or on her client card every time she comes in, from products used to services performed to improvements in the skin to challenges in the skin. We're always going to record everything. Like, we're going to record freckling, we're going to record moles, we're going to record hyperpigmentation, sun damage, excess sebum, breakouts. There's the range of things. There could be some capillary issues, all the things that we would be looking for. Pore size as we go through chin, cheeks, neck, forehead, around the eyes. We're just being really cautious. We're moving the skin around. We're feeling it. We're checking on that texture. And we're really taking some good solid time right here, because this is where we're able to look in a more detailed light. We're also communicating with the client. And the reason we want to do this beyond the service, like what we can recommend, how we can get ideal results from the service, how we can maximize her skin health and skin beauty, we are definitely in it to know her skin or his skin. Because if something changes, let's say for example a freckle or a mole changes, and we recognize the change is not positive, we can then know something's out of our scope of practice, and we'll refer them on to a physician, etc. So we need to be their skincare expert. We need to be really notating those details, and we also can then this will help determine that at-home care regimen that we know will help her achieve the goals that she's going for with her skin or his skin, because we know that they're at home more than they are with us. So this is where we're not rushing, and we have to memorize and keep all of that in our heads, because we will not be doing any of this recording till after the client comes in. It may even be after our next client, so we definitely need to have a way to register those notes so that we don't forget. In between clients, if we've got a full day that's back to back, and if we have time in between each client, we can go to that software system or that client card. But either way, we've got to make sure we're recording what we need to record. So you've done your skincare analysis, skincare of course, but also skin analysis from a professional level. Sometimes a new client may think that they're dealing with something, but they're not really dealing with it. So this is a way to kind of talk through that. Turn the light off, get the light out of the way, and then you can remove that coverage over the eyes, and then we're going to go in for our second cleanse. And certainly once you've done your first cleanse and then you look in the magnifying lamp or the Woods lamp, you can see what's left over that you haven't gotten off, and that's why you want to really go back in and really make sure you're getting that skin in its optimum, pristinely clean health situation. And then we'll go ahead and remove that second cleanse. And then we're going to actually do for this client a third cleanse. And most clients, on a basic facial, you can obviously do all three. Some clients may only need the two, but you decide. This client today, we're going to follow our rubric perfectly, and we're going to do all three. So we're going to remove that third cleanse. And then once you finish that third cleanse, what we'd like to do is, of course, tone. And so I have a spray toner, and I'm going to make sure that my nozzle from my spray bottle does not come into contact with my 2x2s. So we're going to make sure that that has some distance there. And then once you have toned after your third cleanse, we are going to step into the world of exfoliation. Let me just get a sip of water. So what we're going to do now is grab about a pea-size amount of exfoliant. And we are going to do a little spread it out on our client's face and neck. And then we're going to take a good minute or two to massage it in. So you just want to, like all things when you're doing your facial, avoid the eyes, the nose, and the mouth with your exfoliant. And then you are going to, of course, gently massage it in for 1 to 2 minutes. And we're doing that because we have a physical exfoliant here, and you can feel it, and we want to work it around nicely into the skin. And there's physical exfoliants and there's chemical exfoliants, and obviously you're going to be mindful with the type of skin that you're working with and the type of exfoliant that you're working with. You're always going to listen, follow manufacturer's instructions, do all of the right things for your client. But for this particular one, that's what we're going to do. And we also take it on the neck, of course, as well. And once we've done that, I'm going to read you through the next part because I don't have this equipment. So I'm just going to review what we do. We would retrieve the steamer and turn it on. So the steamer is what we prepared before our client arrived. We did the distilled water and we preheated it. So we're going to position the steamer next to the facial bed. Make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, we're going to position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face. Return the steamer to its previous location for disinfection. So we would bring that steamer over to the facial bed and turn it on, making sure that it's facing away from the client. Let it heat up, and then you'll see the steam coming out in a nice even mist. Then you're going to turn that steaming part to where it's about 16 inches away from the client, facing the client's chin, and you'll let it steam across the face for 3 to 5 minutes. Obviously, we don't have it, and for the sake of the video, we wouldn't be doing it for 3 to 5 minutes anyway. So we'll pretend like that time has elapsed. We're going to turn the steamer away from the client. You can turn it off and then return it to where you got it from. And then it's time to remove the exfoliant. Of course, we'll disinfect that steamer once the client is gone later on. So I don't have a hot cabbie either, but I'm going to retrieve a nice steam towel from my hot cabbie and shake it out because it's really hot. I'm going to test the temperature on my wrist. Once I think it's fine, I'm going to test it on my client's collarbone. She says great. And I am going to then gently wrap my steam towel around the client's face with the nose out so that she has a moment here. She can breathe, but she feels that nice steam towel on her face. So you can leave it for about 20 to 30 seconds. You'll start to feel it cool down, and then you'll want to remove it before it gets too cold. So once you feel that gentle cool down, you can then remove your exfoliant with your towel. And don't forget that you also had it on the neck, so you want to remove it there as well. And then once you do remove your exfoliant, you'll make sure that you get those hands nice and dry, because if your client requires any extractions, you're going to want to go ahead and perform them now, and you would need to put on disposable gloves to do that. And it's hard to do when you have wet hands. Another thing to note is you may want your brighter light. Probably you will for extractions. So you're going to go ahead and cover up those clients' eyes again. So I'm just going to do that. I do not have that magnifying light or lamp, but I want you to see what it's like if you were to do that. So the client's eyes are protected. You're telling them what you're doing. You're bringing the light in so you can do the next step. You bring it over and you turn the light on. And now we're going to grab wooden stick Q-tips. You can do extractions with cotton rounds soaked in astringent, where you'd wrap it around your fingers and you'd perform those extractions and kind of work your way around the cotton round, and then you would toss those when you're done doing your extractions. I'm going to do the wooden sticked Q-tip method, where you would take 2 of the Q-tips and you'd soak them in astringent, and then you'd perform 1 extraction and you'd throw it away. So 2 Q-tips per every extraction. My client doesn't have a lot of extractions that need to be performed, but we've got a little bit of congestion on the chin, and so we're going to take care of that for her. So for everyone, we throw it away. Every time we perform an extraction, we throw away our Q-tips. Just got one more that we're going to work on. Toss that. And then we're going to take off these gloves and throw them away. You wouldn't want to perform extractions any more than 5 to 7 minutes on a client, because it can get somewhat uncomfortable, and obviously that you don't want them to be in too much pain for too long. Turn the light off, take it out of the way. You can remove the eye coverage. So just be mindful of that. You want your client to feel great. And then you're going to tone. You do want the skin to get clean, and you want to do the extractions if you need to, but you don't want to spend so much time that they're miserable and in pain. So we're going to do our toner here after we've performed extractions. And then after you've performed extractions and done your toner, you get to go to the good part, which is the massage. So we're going to take some massage product on our hands. And just remember, if your client has severe acne, you would not be doing this portion of the facial. You'd be doing something else because you wouldn't want to be spreading bacteria or making anything worse. So we've got our massage oil, and what we're going to do is we place it on our hands, kind of warm it up, and we're going to spread it out over our client wherever we're going to do the massage. That way our hands won't have to leave the client once we start the massage, and they can truly relax, because hands on and off during a massage is not very relaxing. So you just want to make sure we've got that spread out, and then you can go ahead and begin that massage portion of the facial. now we're going to remove that massage product. And once we remove that massage product, we will now apply our mask to the client. And I'm going to use a brush to do that. Of course, like everything else, we avoid the eyes, the nose, the mouth. And then I know you're going to read and follow manufacturer's directions. And according to the mask you're using, the client's skin condition, all of that, you would be leaving your mask on for a set amount of time. And we're going to say for all intensive purposes, this mask is to be left on anywhere from 5 to 10 minutes. And we're just going to imagine that that time required has already elapsed. And I'm going to go ahead and remove the mask at this point. And then once we've removed that mask product, we will do our final tone. And then her skin looks amazing, so we're going to finish it with moisturizer and eye cream and lip product. Of course, we need just a teeny bit of eye cream because we are going to be applying that with our ring finger, and that's the most delicate finger. And we're going to rub our ring fingers together, and we're going to do a light tapping motion where we apply it on the zygomatic arch and the brow bone. And then for her moisturizer during the day, we're going to do a hydrating one with SPF and a nice physical block of sunscreen. In that, she is replenishing that today. She absolutely loves it and can't live without it, which we all do. And we know the importance of an SPF, certainly a physical SPF, so we're going to put that moisturizer all over her face and neck. And then if you have the décolleté exposed at all, any of that, you want to add it to there as well. Ears, if she has short hair. She's definitely going home with more SPF today, and a few other items that we're adding in. And then we're going to give her some lip hydration to finish it off, because everybody wants to have beautiful hydrated lips. And then we will present her skin, because everything looks so gorgeous and she's just so happy. And then we will give her a few moments to absolutely change back into her regular clothing. And we'll go out into that client consultation area, wait for her there, so that when she comes out, we can review any maintenance and aftercare that she needs to go over. We have discussed and are already in process of in a series of appointments trying to get her skin to its optimal beauty and strength and health before the holidays. So we've got a few more weeks before Christmas, so we're getting her booked in for her next appointments. And we get her checked out, we get her going home with that SPF that she needs, and she needs a couple of other things like her night cream and a serum. She's really seen a difference with the other products she's gotten from us, and so she wants to keep it up, and just as she runs out of things, she's replenishing. We're super proud of her. So she's out the door, and we need to get back to our room to get it ready for our next client that's coming in, also for a basic facial. So we've got to disinfect this room. The first thing that we're going to do is we're going to look for any single-use items that we haven't discarded and go ahead and throw those away. Looking for any dirty implements, we need to put them in a closed container that is labeled to be disinfected. We're going to strip the bed of all the sheets, the linens, the dirty towels. Excuse me one second. And all that dirty linen and towels is going to go into a closed container until it's time to do the laundry. Then we're going to find and identify a proper cleansing agent, and we're going to read and follow manufacturer's directions for mixing and usage. We'll do that following the directions, and then we can wipe down our workstation and area for any dirt and debris. Excuse me. I have a little tickle in my throat. Then we're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. We need to go ahead and put on a pair of disposable gloves. We'll realize that as we read and follow manufacturer's directions for mixing and or excuse me, using appropriate aerosol disinfectant. We'll disinfect electrical equipment stored in a clean area separate from other implements. And then to finish up, we're going to do that hand wash before I totally choke up. We're going to wet our hands under the running water. Excuse me, get a coin-sized amount of liquid hand soap. Wash our hands down to the wrist. Wash the back of our hands down to the wrist. We're going to wash our fingers, and we're going to wash the back of our fingers. We're going to wash our fingertips and nails, between our fingers and our thumbs. We're going to wash our thumbs. We're going to wash our wrists. We're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. Once we've got it properly cleaned, we can thoroughly rinse them underneath the running water. When they have had that proper rinse, grab disposable paper towels or a clean towel, turn the faucet off with the towels, completely dry off your hands. You're gonna toss the dirty paper towels into the trash. If you used a clean towel, it's now dirty and it can go in with that other dirty linen in a closed container. Then you're gonna grab your hand sanitizer, make sure that you have 70% ethyl alcohol in order for you to do that. Same interlocking cleansing motion with your hand sanitizer that you do with your liquid hand soap, making sure you get it all done. And then when you've finished all of that, it's official. You can move forward and set up for your next client. So that concludes your video for basic facial.